Idelalisib is a first-in-class PI3 kinase delta inhibitor. PI3 kinase is a protein that sits downstream of the B-cell receptor, and it's very involved in not just B-cell receptor signaling, but a variety of other pathways that are important in the survival of B-cells. Idelalisib in clinical trials has shown efficacy, and in fact it's approved in Europe for the treatment of refractory follicular lymphoma and for chronic lymphocytic leukemia. The drug is clearly very active. It's been used alone and in combination, and I'm going to be discussing the results of the study. The main issue with the idelalisib are some of the side effect profiles associated with its use. Many patients, it's a therapy that you go on and you continue on continuously, and what we're seeing is that there's a high proportion of patients start to develop some side effects. Now, many of the side effects are very transient, quite manageable, can be managed by just interrupting the drug, stopping it for a period of time, and then restarting either the full dose or a reduced dose. Some people need what we call drug holidays, coming off the drug for a period of time to recover, and then can be successfully re-challenged. But there are some specific side effect profiles with the use of this drug that are probably immune-mediated. The protein is expressed in T cells as well as in malignant B cells, and by switching off some of those probably what we call regulatory T cells, you're allowing the immune system to become more active. And some patients develop colitis or pneumonitis, which can be very, very severe complications, which if not picked up quickly and treated can lead to real major complications. So although the drug's very active, what we are seeing is that perhaps the progression-free survival with the treatment of the drug not being quite as good as you would think it could be, because patients cannot stay on the drug indefinitely in the way that it was hoped to be the case. The development plan is to be looking at how we can use this in combination with chemotherapy and monoclonal antibodies to potentially decrease the duration of time of treatment, and how we can add to other agents. Very little data for me to talk about yet, but clearly another way in which it's being developed is the so-called novel combinations. That's putting idelalisib in combination with some of the other new drugs that are emerging. And clearly the plan there would also be, can we get to a point where we are treating patients for a defined period of time, stopping the drug before these side effects become problematic. One of the huge advantages of idelalisib is that it's an oral medication. It's 150 milligrams twice a day. It means that patients have to remember to take the drug twice a day for a very long period of time. And of course, there's all sorts of studies being done with other oral medications that show that whereas at the beginning, when patients know that their disease has to be being treated, there's a very high motivation to continue the drug. What studies have shown, not specifically with idelalisib, but with many other classes of drugs like this, is that the adherence to the regime decreases over time. That's particularly the case when patients do have some side effects, particularly GI upset can be. It's all very easy to continue the drug at a time. You can see your lymph nodes shrinking, and you can see that your blood count's returning to normal if you've got CLL. It's something else to continue that drug twice a day, every day, when the disease is already gone. And I think there are issues of patient compliance that haven't been well addressed and have to be thought about much more carefully. I think this is a very effective drug. It's very easy to administer, but it does require careful monitoring for some of the side effects. The particular side effects to look for are rise in the liver enzymes. That's very transient. It can often be managed by just stopping the drug or decreasing the dose temporarily. But there are two major complications that people have to be on the lookout for to pick up early. One is this later colitis, very severe diarrhea, which occurs out of keeping with the kind of mild GI upset that patients often have earlier in the treatment course. Real indication to stop the drug, treat that colitis aggressively. The other one is pneumonitis, which can occur earlier, probably within the first 6 months of treatment. And any kind of suggestion of pulmonary infections are an indication to really monitor a patient very, very carefully for those particular side effects. Other than that, when the drug is tolerated well, it can be very easy to administer.